Hi, I'm Dr. Nachbar. Abdominoplasty is often the best way to treat excess skin and fat that can occur in the abdominal area, often after pregnancy and weight loss. Liposuction can help if there's only a little bit of excess fat without much extra skin, but when there is extra skin or bulging of the underlying muscle, usually abdominoplasty will produce a much more dramatic and much more effective result. I do all my abdominoplasties with the no-drain technique, which I've used for all my abdominoplasties since 2008. I use that technique to reduce the pain and discomfort following the procedure, as well as to reduce the incidence of seroma, or fluid collection, which is the most common complication from abdominoplasty done using a drain technique. To explain the difference, I'll need to show you how abdominoplasty works. Abdominoplasty is performed by making an opening in the lower abdomen, raising up the fat and skin all the way up to the breastbone, tightening the muscle by folding it together, and then pulling it down. We leave the belly button attached to the abdominal wall, but after we pull it down, we cut the excess off and sew it all up. Now, if you do the procedure that way, you'll almost certainly get a seroma. The reason for that is that the tissue releases some fluid into the space between the fat and the abdominal muscle wall, and that fluid will collect. So the usual way to treat that is to use what's called a drain, which is simply a tube that goes into the space and is designed to remove the fluid. What is different with the no-drain technique is that before I sew the skin down, I put a whole bunch of stitches, often between 40 and 50, between the fat layer and the underlying muscle. That way there's no space for the fluid to collect and the drain is not needed. Because seroma is the most common complication of abdominoplasty in the literature, there have been a lot of studies looking at seroma in abdominoplasty. One of the largest was published in the Plastic and Reconstructive Surgery Journal, or PRS, in 2013. That study looked at over 1,000 patients having abdominoplasties done by 6 different surgeons. In that study, they found an average incidence of seroma of about 15% among all 1,000 patients and all 6 surgeons. Of the 6 surgeons, the surgeon with the lowest incidence of seroma, which was about 7%, left his drain for almost 3 weeks on average. And that was really my experience when I was using drains with abdominoplasty as well. Unless the drains were left in for about 3 weeks, it was pretty likely that some of those patients are going to get a seroma. I mentioned drain duration and its relationship with the instance of seroma formation because I have had patients tell me that there are surgeons out there telling them that they can remove the drain after only a few days, sometimes even less than a week. Personally, I would be very skeptical if I heard that. If I had a surgeon tell me that, I would ask them if there are any studies anywhere in literature they can show where anyone else besides them is able to remove the drain in less than a week with the still acceptable rate of seroma. And if not, if their experience is better than any other experience in any article, in any journal, anywhere, why haven't they published their better results, their more superior results, in another peer-reviewed journal? On the other hand, one group of surgeons published their experience with almost 600 patients having abdominoplasty with the no-drain technique. In that paper with almost 600 patients having abdominoplasty with the no-drain technique, they only had 1 patient with seroma. And that is why, in a paper written on evidence-based recommendations for abdominoplasty and published in the PRS journal in 2014, the recommendation was made for no-drain abdominoplasty as the technique best supported by the current evidence. In addition to the dramatic reduction in the incidence of seroma, my experience with the no-drain technique is that patients have significantly less pain and discomfort, able to get around better, more quickly, able to drive more quickly, and that should allow them, by moving around more quickly, to reduce the chance of having other complications from abdominoplasty as well. If you want to know more about no-drain abdominoplasty, please call my office or use the online appointment tool on the website to make an appointment for a consultation. Then we can sit down, we can go over your exact situation and tell you whether abdominoplasty can work for you. There's no charge for the consultation, and the online appointment tool will let you confirm a specific date and time for your appointment immediately.